Hi, my name is Rich. I'm the founder of Medical Referral Hub. With us today is Dr. Marlene Hurd Allen and our favorite physiatrist in the Houston area, Dr. Craig DiTommaso. Dr. DiTommaso, how are you doing today, sir?
I'm doing well. How are you doing, sir?
I'm doing well. Thank you for joining us again at Medical Referral Hub. Today we want to talk to you about a few things that families might actually go through after a loved one has experienced an injury or a setback. So let's jump right into it. Based on your personal experiences with your father's spinal cord injury rehab, what would you say are some of the subtle challenges that families might face?
Yeah, families face so many challenges after a major illness or a traumatic injury. It can all be overwhelming. And I think the things people think about are dealing with the immediate medical issues and getting back on their feet. But some of the more subtle things that you bring up is really how the family dynamics evolve after the injury. Depending on the person's role in the family, kind of everything can be turned on its head. From my experience, my father was not only kind of the breadwinner for our family, but also really kind of the driving force in how we interacted and what we did and what our avocational pursuits were. After his injury, we really had to recalculate all of that. And it took a lot of changes and a lot of adaptation throughout our whole family. We all had some caregiver roles, which was new for us, obviously. My father was so strong and had been the leader of the family, now needing us to care for him. Things both physically for us, time constraints as well, but also from a psychological value, we had to kind of reset to that. And I think for him, as well as us, we all had to go through a period of transition and change to understand how that went. And I think that was a real growing opportunity for all of us.
Good.
Goodness. So it's been over 2 decades, right, since your dad had the injury?
Correct.
And you're saying some of the things that your family had to do. Do you see any similarities or differences right now with today's medical approach in the treatment for the traumatic brain injury person and the family's adaptation to it?
Yeah, no, I think there's been lots of changes, Dr. Hurd Allen, and I think that one of the most exciting things is all the new technologies in the field. We really have grown a lot as far as our understanding of the medical pathways that are most effective for treating these patients. We've progressed as far as the imaging that allows us to understand what's going on inside the body. And then as far as rehabilitation technologies, more use of robotics and interventions that can really help people get up and get moving and recovering faster. I think those are the positives. On the negatives, there's been a lot of financial and organizational stress to make medicine more efficient, if you will, to kind of streamline things. And while I think in some ways this has helped patients to get to their destination quicker, in a lot of ways it's put stress on both the healthcare workers as well as the families, because the pathway is so much shorter, so much quicker, and so much more direct. And then it doesn't allow for some of the psychological healing and also some of the interpersonal relationships to develop the way they did maybe 20, 30 years ago. And so I think that puts a lot of stress on both the families and the caregivers, and something that we need to be conscientious of.
So with that, when your dad had his injury, we're looking again 2 decades ago, there was stress on the family, but with the advance maybe in technology and treatment approaches and the time frame you're saying, it makes it a little bit more stressful, you think, for the families?
Well, there's trade-offs, of course. I don't know, it's more or less stressful, but I do think there's a lot more stress around the speed at which things move.
Okay.
Before, whereas families had times to maybe sit back and think about what happened and kind of recalibrate, for lack of a better word. Now they can push so quickly to get the acute care done, to get the rehab done, to get back home, to get a system up in place, to get back to work or to declare disability. I think emotionally and psychologically, that's very stressful on families, and I don't see that changing anytime soon.
They need to have more time to process what's actually going on. In my day-to-day, I see this as well as a clinical liaison. they want these patients to get up and move immediately. The families, excuse me, they want decisions made. You've got 2 days to figure out if you want your family member to go to a SNF or to go to an inpatient rehab, or they deny a certain level of care that the family was expecting. It is a lot, and it's a lot of stress. I completely
And the family
understand.
probably haven't even yet absorbed the new diagnosis or the change in their loved ones. Like Dr. Craig was saying, here it is one day your dad was the breadwinner and doing everything, and then in a moment's notice everything has changed. So yes, adaptation is a huge factor.
And I'm certain that 95% of the families aren't prepared or even thinking about this type of thing. And then they're submerged into the healthcare world and the referral process. And I completely understand it can be really stressful. So it's best to be prepared for this sort of thing. Hopefully there can be some type of system to begin preparing families for a transition like this, if there's a need for it. Wow, great answer. Thank you, sir. So aside from the challenges of being physically disabled, a person with a traumatic brain injury or spinal cord injury will most likely face some level of discriminatory practices. How have you dealt with issues in that regard?
Well, I think these issues are really difficult and very sensitive. I think no matter someone's role in society or their understanding, until you've kind of lived through a traumatic brain injury or spinal cord injury or other major medical problem, you really don't see how that person changes and evolves. But also, I think it's easy to distance yourself from a person like that until it's been a loved one or yourself going through it. It seems like an other problem. It's something that you don't have to conceptualize and think on your own. And so I've seen cases of physicians, nurses, social workers, everyone in the medical field really limiting or making judgments about what is or is not appropriate for patients because of previous injuries or illnesses that have changed their functional level or their cognitive level. And that to me is really, really difficult, because these patients have so much potential. They have so much to offer, and they remain such integral parts of the family, even if there have been physical or psychological or cognitive changes. And I don't think those decisions should be entered into lightly. And so I think it's a constant battle to keep everyone honest about really assessing what's right for that patient and that family and getting them the treatment that's appropriate.
That is so true. You mentioned about with nurses and doctors and others, but yeah, in the healthcare setting, for example, myself, when I was a bedside nurse, and you go in and then there's the family dynamics, because there's sometimes one family member was a distance away, when the injury occurred, and so they weren't there physically to see what happened, and then they're demanding information from the one who was present. The one who was present is still trying to process it. And then comes the decision making. Okay, what do we do? Do we go this route or go that route? And then that makes it very difficult, very, very difficult. And then the caregiver too is kind of, I don't want to say caught in a wedge, but you have to put yourself in such a position. You have to be empathetic in one area and sometimes sympathetic. You have to try to balance that to help that family to cope. And don't ever put yourself like you're taking sides.
So true, Dr. Hurd Allen.
Yeah, that's also another stress level, because we don't know what other issues that the families are dealing with before this occurred. So that is a very, very sensitive area for just about any illness, more so the traumatic brain injury. So Dr. Craig, and again, we're how many years ahead now, but in your practice and in your associations, are there any, would you say, like specific mandated programs to help families, especially the traumatic brain injury person?
Sure. So there's lots of small local programs, and I can't keep track of all of those. I think if an individual has an injury, to start to reach out and see what resources they can find. On a national level, both the Brain Injury Alliance and the Brain Injury Association of America have large national networks that can help people find resources and develop benefits and help them navigate what's best for them and what their family needs. The other place I always recommend people checking out is the Model Systems Knowledge Center. So the United States a long time ago established that there would be model centers for care of specific injuries, in particular brain injuries, spinal cord injuries, as well as burns. From these model systems, they've kind of developed some pathways and some resources that really can help to educate families and get them going. So I would encourage that if you're dealing with one of these traumatic injuries or severe burns, to think about looking at the Model Systems Knowledge Center. I think that can be tremendously helpful. But really don't underestimate those local resources. Your church, your synagogue, your local YMCAs, things like that, they have resources as well. You have to really just dig up and see what's in your area.
You know, you just mentioned, thank you very much. You mentioned your church, and it made me think back when we had a situation with a very close friend that had lost both husband and son in a horrific crash, and that support that's needed immediately. So just like you said, don't underestimate the local support system, because that's there to kind of help you get moving. So thanks for that.
Absolutely.
So I think every community has a little bit different needs, so it's hard to paint with broad strokes. The communities have to be aware and sensitive to the individuals in their community who have disabilities. A recent publication estimated that 25% of all adults in America have some level of disability. Most of it hopefully very mild, but we know that all of it's not. And so you realize that these people are part of their community, and if they're not interacting with them, oftentimes it is barriers in the community that prevent these individuals from getting out and enjoying life and maximizing their quality of life. So the communities themselves can offer disability accessible access to restaurants, to parks, to things like that, which will help them. There are vocational things that communities can offer, and oftentimes by partnering with someone like Goodwill or another organization, they can start to retrain these individuals so they can get back to work, which is so important in our culture, of course. And then lastly, and I hate to put any more stress on these families, they are going through so much, their lives are totally torn upside down, but they've got to be good advocates, right? Nothing's going to change in the community, let alone the state or the country, if people don't let their needs be known. They don't talk to their representatives, if they don't advocate for what they need in order to optimize their independence. And so as much as these families can do, and I know I'm asking so much, I know there's so much on their plate, but any little bit that they can do to let their needs be known, to let their representatives know what it is that they're lacking or what would help them, helps to get us momentum and helps to get resources towards these people. Dr. Hurd Allen, I know you have tremendous clinical experience as well as amazing life experiences. Have you seen someone who was kind of preparing for these challenges?
Oh, yes, most certainly. I've seen those who prepare and I've seen those who haven't prepared. And recently I had an associate of mine that was diagnosed with one of these life-altering, disease process. And she was very specific in what she wanted and what she did not want done. And this is while she was up doing everything in the normal sense. And that made it so much easier for the family members that they did not have to make the decision for her. For example, she decided, okay, when it comes time, I did not want to have a feeding tube. When it comes time, I did not want this. When it comes time, I did not want that. And all that she agreed to have was just general oxygen. And she was diagnosed with ALS. And we watched her where she communicated regularly. Then, thank God for today's technology, text, got to the point where she was able to text messages and we would communicate like that. And then after a while, it was just with the eyes, as you've seen some of these with the brain injury. But it made it so much more easier compared to the person where there was never any discussion as to if something happened to me, how I would like to have stuff. And then we see at the bedside, families literally grappling, because one person says, okay, we let him stay on the ventilator. And another person says, no, what kind of life is that going to be? Or no, mom wouldn't like this, dad wouldn't like that. So from my experience in years of seeing it really makes a difference if families would have these conversations. You're not saying something is going to happen to you, but life is so unpredictable, as you as a teenager saw with your dad. So from that standpoint, I've seen those who had some level of preparation, and it's not that you're prepared expecting something to happen, but it's like when you say hurricane season, you never know what's going to happen. So just have that preparation that if something happened, okay, this is what needs to be done, versus having, for example, if you have a large family, it's 7 siblings, there's 7 decisions right there. And I've seen that happen. And then next thing you know, it goes over to where you have the ethics committee to make the decision, because the family cannot come together. So yes, to your question, yes, I've seen that.
I think that's really powerful, and I think that's important. And as a rehab physician, I think I'm often very conflicted because I see so much potential in some of these individuals. Because you've gotten sick or had a traumatic injury, you can look very, very poor 1 minute in the intensive care unit, but I know that 6 months later, you may not look the same, as opposed to other individuals, especially as we get older or we have more chronic injuries, the chance for recovery or looking much better in 6 months can sometimes be a bit different. And so it really has to be a nuanced discussion. And I think that there's no way to paint with broad strokes on that. Having your family understanding what it is you want to achieve is very important. So we can say, hey, in 6 months, maybe we do have a chance to give them some quality of life and get back. Or no, it's just the way that your family member would want to live for the rest of their life, 6 months, a year, 5 years later. So thank you for bringing that up. It's really, really important for families to think and talk about.
Well, just to add that from the flip side, I remember in my early years in nursing, we had a lady who was, she was on the ventilator. At the time, we didn't hear traumatic brain injury so much, but obviously that was that. But this went on for months, because I remember one summer, her temperature skyrocketed so much that they literally got ice from the local bars. Seriously, that's before we had those cooling blankets. It literally packed her in ice. I witnessed that. Mm-hmm. And to see months later, I go in one evening, it's like if I would say, good evening, Dr. Craig, how are you? You just always greet the patient regardless. And the response was, fine, thank you, and how are you? I almost passed out. Mm-hmm. So just like you said, 6 months later, and for a new nurse, that was life-changing. Mm-hmm. So, which as later on now, maybe a decade later, when we had someone who had Guillain-Barré and got to the point where, they just totally flaccid, no communication, not even the eyelids moving. And then there was this wife, and she said, no, he's fine. He's coming out of this. He's coming out of this. The staff, everyone saying that she was in denial, including myself, because of what we physically saw. But apparently they had this communication. Long story short, this person who was bedbound, flaccid, not communicating, walked out of that hospital with a cane. Wow. So again, just like you're saying, Dr. Craig, there should be some open discussion. So thank you.
Great. Yeah, thank you, Dr. Hurd. That was fantastic.
Hey, Dr. Craig, thank you so much for joining us today on Medical Referral Hub. Please, as always, say hello to your wife, Amy, and Lorenzo and Isabella. We greatly appreciate them like we greatly appreciate you.
It's my honor to be here. Thank you for having me.
All right. You have a great rest of your day, sir.
Bye-bye.
Bye.
Be safe.